really don't think I chose healthcare. I think healthcare kind of chose me. You get pulled into it, and it's just hard to let go.
I think it's a special kind of person that works in healthcare, and I find it's very rewarding working with those people because we're all like-minded.
I had an experience with my dad having terminal cancer, and he was in and out of hospitals for about a year when I was in high school, and I was really motivated by the physicians I came in contact with through the care they provided him.
You know, I always thought, you know, when people get older, that somebody always needed to be there for them. And when I was younger, I said, oh, I want to work in a nursing home.
You know, I chose healthcare because, you know, any job you do work, but in healthcare you actually feel some value on it because you're affecting patients directly.
I am very satisfied with the work I do because there are times when you really know you have made a difference in a patient's life.
I would probably say I always had this feeling inside that this was a calling that I had in my life, was to care for people.
I chose the healthcare field because my father was going through a lot with his health. I helped him to get through the process of lung cancer he had.
Well, the reason I have a passion for it because I want to be treated the same way when I get to that age, you know what I'm saying? So I treat them as they're my own.
Well, I really wanted to make a difference, to really enrich and help other people's lives, you know, and I like working with people in the process of healing, and that's really been something I've loved for many, many years since I was a young man.
There is no better thing to do in the world than to provide, so to say, relief from the suffering, whether it's physical or mental, and I think that's one of the good thing you can do in life, and that gives in return a great gratification of having done a good thing.
When someone stops back unannounced and says, you know, I just want to thank you. You were so instrumental in helping me make a change in my life. It means so much.
You have to have a passion and the positive attitude toward others, and also you have to know how to love other people.
It's rewarding. Every day is a little different. That's what makes it so unique and fun to be here.
You can't teach somebody to care. It is something that comes from within, and obviously that's going to be part of your personal life. It spills over into your professional life, but caring and being part of the team is what nurses do.
Honestly, I stay in this position because I love my patients. I love my patients. I work with incredibly competent, wonderful doctors, and I couldn't be happier.
I see little kids when they came in and they weighed 5 pounds, and then, you know, 3 years later they're walking in and talking, and it's amazing to see that.
There's no greater feeling than helping someone through a rough patch. You don't need any awards or merits or pats on the back. It's just the satisfaction of seeing someone get well and know that you had a part of their recuperation.